Okay, so the coronary arteries, when you have dissected the heart, at that time I hope you have seen some of the coronary arteries. Okay, so today we will see in detail about the coronary arteries. I will request everyone, please stop talking. Now, in case of coronary arteries, okay, I don't know what you have studied exactly, but in the exam point of view, if this particular question comes, then exactly what you have to write, okay, that we will be discussing today. Along with that, which diagrams you have to draw, okay, that that also will be discussed today. Along with that, the applied importance of the coronary artery, especially which is related to the MI or myocardial infarction, okay. Now, if you see the diagram, okay, in this diagram, I hope you have seen such kind of diagram. In this diagram, you can see the coronary arteries. Two coronary arteries are there. Okay. Now, I hope you have studied about the coronary arteries, how many coronary arteries are there, then the area of supply and some branches. Apart from this, there are some other points also which you should know. For example, if I ask you, what are the peculiarities of the coronary artery? Have you studied about the peculiarities of the coronary artery? No, you have not studied about the peculiarities of the coronary artery. Next, you know that two coronary arteries are there, but there are some cases where a third coronary artery is also present. Can you tell me the name of that third coronary artery and why it is called as third coronary artery? Okay, so like this, there are some points. Next, in case of this one, aortic sinuses, the origin of the coronary arteries. Okay, how many aortic sinuses are there? Three aortic sinuses are there. Okay, from which the coronary artery arises. Next, if I ask you why these arteries which are supplying the heart, why they are called as coronary arteries? Okay. Next, do you know these coronary arteries? Actually, they are not end arteries, but they behave like end arteries. Why? Okay, so there are many questions. Next, if it is related to the applied part, okay, especially in case of myocardial infarction, in acute case of MI, myocardial infarction, which a particular artery is involved, okay, then there are some terminologies. For example, if I ask you what is the difference between infraction and what is the difference between ischemia, okay, so what happens in case of ischemia? What happens in case of infraction? So like this, there are some important terminologies which are related to the applied part. Okay, that also will be discussing today. Okay, so in case of coronary artery, as you can see in the diagram, two coronary arteries are there. Okay, so starting from the origin, you can see both the coronary arteries. Along with that, you can see the branches also over here in this diagram. You can see their termination also. Okay, so first, in case of any coronary artery, especially whenever you have to write it in the exam, so please keep that in mind. First, you have to mention about the origin of the coronary artery. Okay, either it is right or left. Okay, so first you can see the origin of the right coronary artery, and here you can see the origin of the left coronary artery. From the origin, you can see this is the course of the coronary artery. So in this case, this is the course of right coronary artery. Here, the course of left coronary artery. Next, after the course, you can see the branches. Okay, so branches mainly it is divided into atrial branches and ventricular branches, so also called as atrial rami and ventricular rami. Okay, as you can see over here. Okay, various branches are there, and lastly you can see the termination. Now the termination which is taking place in case of coronary arteries, mostly they are anastomosing with each other, and then the termination is taking place. Okay, as you can see in this diagram, so this symbol is for anastomosis. Already you have studied. Okay, so these are the points which you should know, and along with that, suppose if the right coronary artery is there, so which particular area of the heart will be supplied by the right coronary artery, and which particular area of the heart will be supplied by left coronary artery, that is also fixed. Okay, Next, another important terminology is there in case of coronary arteries, that is the cardiac predominance. I hope we have heard about it. Whether it is right dominance or whether it is left dominance. Have you studied about that? Yes. So it is based on what and why? Okay, whether it is right dominance or left dominance in case of coronary artery, why it is right or why it is left dominance. Okay, and that also why it is called that right dominance and left dominance. What is the reason behind that? Okay, so these are some important points which you should know, and followed by the applied part. Okay, so now if I ask you that why the coronary arteries are important for the heart, because we know that chambers are there. Okay, so inside those chambers blood is present. Then why we will be needing the coronary arteries? Apply common sense. We know that from the chambers of the heart, the blood is distributing throughout the body, in the various part of the body, right? That means inside the chamber, you know that blood is present. Chambers के अंदर क्या रहता है? In case of heart, blood is there. Then why we need these coronary arteries? Do you remember about the vasa vasorum, which we have studied in case of histology of blood vessels? If not, please study that concept while explaining about the blood vessel, histology of blood vessel. Okay, about the layers. At that time, I have mentioned about the vasa vasorum, importance of the vasa vasorum. At that time, I have asked you this question. Okay, so here the coronary arteries, these are the vasa vasorum of the ascending aorta. That is also a peculiarity of the coronary arteries. Now the coronary arteries, these are referred to the blood vessels, okay, which will supply blood and will drain blood from the heart. Now why these are called as coronary arteries? Because if you see, they branch in such a way that they will encircle the heart, okay, both on the anterior aspect and on the posterior aspect, just like a crown. That's why it is called as coronary artery. Okay, that means the right coronary artery and left coronary artery, the branches on the anterior aspect and on the posterior aspect of the heart, okay, it is encircling just like a crown. That's why it is called as, these are called as coronary arteries. Okay, so you know that there are mainly two coronary arteries, right and left coronary artery. Okay, from where they are arising? As you can see, they are arising from the aortic sinuses of the aorta. Okay, I hope you have studied about the aortic sinus. Now these aortic sinuses, these are nothing but the small openings, okay, where they are found within the aorta, behind the right and left flaps of the aortic valve. Okay. Now when the heart relaxed, okay, the backflow of the blood, okay, when the heart is relaxed, that means during the time of diastole, the backflow of the blood, okay, will go inside the coronary arteries. Like this, the blood from the ascending aorta is reaching the coronary arteries. Okay. Now just now I have asked you one question, why these coronary arteries are required, why they are important? Because inside the chambers the blood is present. Then why additional blood supply is required for heart? Because 75 to 100 micrometer of the endothelial surface, okay, get nutrition directly from the blood which are present in the chambers. Up to that much thickness of the part of the portion of the heart is receiving blood, or you can say receiving nutrition directly from the blood which is present inside the chamber. Okay, apart from this, the other parts, for that the coronary arteries are required, okay, which have to supply blood to the other parts apart from this particular area. That's why the coronary arteries are required. Okay. Next, as I said, anatomically these coronary arteries are not end arteries. I hope you know what is the meaning of end artery. Okay, so anatomically these are not end arteries, but functionally they are behaving like end arteries. What is the meaning of this? So in this particular diagram I have shown you, these are the branches. In between the branches you can see the anastomosis is taking place. Okay, so the anastomosis which are taking place, the anastomotic channels, it takes time to open those anastomotic channels. Okay, that means suppose there is a myocardial infarction in a younger age, and if a myocardial infarction is taking place in older age, what do you think which will be more dangerous? In younger age. Why? Because in young age those anastomotic channels are impervious. Okay, they are behaving like end arteries. So as the age advances, those anastomotic channels it opens. Okay, so that the blood can flow from either direction, or you can say collateral circulation. So there is also an important aspect of the coronary arteries. Okay. See, today I hope you are having exam. I don't want to scold anyone before the exam. Okay? I don't want to scold anyone before the exam. I have requested everyone that please give me 30 minutes. Within that I will complete an important topic. I know you have not studied this in detail, which is very important and interesting. After that, if you guys don't feel like attending the class, you can leave. Okay, don't compel me to take strict actions, all those things. I don't want. Okay. Next, here you can see the coronary artery, the origin of the coronary arteries. Okay, here what you can see, the cut section of the ascending aorta. Okay, now you know that different types of valves are there in our heart. Okay, so the valves which are present in case of aorta, aortic opening and pulmonary opening, which type of valves are these? Semilunar valves. Very good. Okay, so here also you can see the semilunar valve is there. Just beyond the valves in the ascending aorta, 3 dilatations are there. Those are called as aortic sinuses. Okay, so among them 2 are coronary sinus and 1 is non-coronary sinus. So here you can see this is one dilatation here and here. Okay, so from this 3 dilatation, 2 are coronary sinuses from which right and left coronary arises, and another one is non-coronary sinus. No artery is arising from that. Okay, so that is the origin of coronary arteries, right and left. Next, as I said, there are some peculiarities of the coronary arteries. What are those peculiarities? First of all, coronary arteries are the vasa vasorum of the ascending aorta. Okay. Next, already I have mentioned anatomically, these coronary arteries are not end arteries, but functionally they behave like end arteries. Okay, and I have discussed the significance of this. Next, these are the only branches of the ascending aorta. Ascending aorta don't have any other branch apart from this. And next, these are the only arteries which get filled during the diastole of the heart. In physiology, you have studied what is systole, what is diastole, right? So during the diastole of the heart, these coronary arteries get filled by blood. That is a peculiarity. Okay, so next we will start with the individual artery. So right coronary artery is there and left coronary artery is there. Okay, so I will request everyone to please follow the pattern. Okay, because same will be followed for the left coronary artery also. So first, in case of right coronary artery, what we have to know? We have to know about the origin of the right coronary artery. So if you see the origin of the right coronary artery, just now I have shown you in the diagram from where it arises. It arises from the right aortic sinus of the ascending aorta. Right aortic sinus of the ascending aorta. Okay. So once it arising, after that, do you remember the grooves or sulci which are present in the surfaces of the heart? Grooves or sulci? Yes. So you have studied about that. What is the significance of those grooves or sulci which are present on the heart? Those coronary arteries, okay, mainly they are passing through those grooves and sulci. Now, if you see the right coronary artery, okay, the rise to several cardiac arteries. Okay, that means from coronary artery we are getting various cardiac branches, especially they will supply the various structures, for example, right atrium, right ventricle, interventricular septa, some part of the interventricular septa, some part of the AV node, okay, and the SA node. Now, if you see the course, so after arising first, okay, so you have to understand the course of the right and left coronary artery, and the course is not same, it is different for both the artery. Now in case of right coronary artery, first of all, after origin it will pass forward and then to the right, and then it will emerge on the surface of the heart. Now when it is emerging on the surface of the heart at that time, okay, it is situated in between the pulmonary trunk and the right auricle. Okay, after that it will run downwards and laterally, that also towards the right side, okay, near the right border or along with the right border of the heart. Now when it is descending laterally, that also on the right side, it passes through the right anterior coronary sulcus, okay, and then it reaches the junction between the right and the inferior border of the heart. Once it reaches the inferior border of the heart, it will wind around the inferior border of the heart, and then it will go to the diaphragmatic surface of the heart. Okay. Now once reaching the diaphragmatic surface, it goes backwards and to the left on the right posterior coronary sulcus. Okay. Next, what it will do, it will from there it will reach the posterior interventricular groove. Now in the posterior interventricular groove, here you can see the origin of the right coronary artery, and here you can see the left coronary artery. So see, after arising, when it emerges in the surface of the heart, you can see it is between the pulmonary trunk. So this is the pulmonary trunk and this is the right auricle. In between this, you can see it is descending downwards, that also laterally. Okay, when it is descending downwards laterally, it is descending along with the right border of the heart. Then you can see it is reaching the inferior border. Once it reaches the inferior border, you can see it winds around the inferior border of the heart, and then it goes to the diaphragmatic surface of the heart. Okay. Once it is going to the diaphragmatic surface of the heart, okay, see, it is going to the diaphragmatic surface, then it goes backwards and towards left side on the posterior interventricular groove. Okay. Ultimately, it will reach near the crux of the heart. Now, near the crux of the heart, what will happen? The left coronary artery, that means the LCX, left circumflex branch. As you can see, the left circumflex branch, which is coming like this. Okay. So it will terminate by anastomosing with the left circumflex artery, which is a branch of left coronary artery near the crux of the heart. I hope you have heard about the crux of the heart. Okay. So this is the origin, course and termination of the right coronary artery. These particular points should be mentioned whenever you are writing about any of the coronary arteries. Okay, and for that the best way to understand the course is the diagrams. Okay, there are some easy diagrams I have selected. This is not the drawable diagram, you don't have to draw. Okay, there are some easy drawable diagrams which I have selected. I will show those diagrams to you, that will help you to draw the diagrams during the time of exam. Okay, so where it is terminating, as you can see, it terminates by anastomosing with the circumflex branch of the left coronary artery. Okay, slightly left to the crux of the heart. That is where it terminates. Okay, so as I have mentioned earlier, whenever these arteries are terminating, they will anastomose with their counterpart. Okay, that means the right side will anastomose with the same branch of the left side, and then it will be terminating. Next, there are three segments of the right coronary artery: proximal segment, mid segment and distal segment. Three different segments are there, as you can see in the diagram. So in this particular diagram, the heart is removed, only the coronary arteries are shown, so that you can understand the branches. Along with that, you can understand the course of both the coronary arteries. So here you can see the proximal part, you can see the middle part, and you can see the distal part of the right coronary artery. Same can be seen for the left one, so that we will be discussing later. Now we have seen the origin, we have seen course, and we have seen the termination also. Next, the most important part, that is the branches. Okay. Now as I said, please keep that in mind, branches are divided into two categories. What are these? Atrial rami and ventricular rami. Ventricular rami ka matlab kya? What is the meaning of ventricular rami? Means the branches will supply the various part of the ventricles. Okay? Atrial rami means it will supply various part of the atrium. As simple as that. Okay? So first here we are getting the ventricular rami. Under ventricular rami there are different branches present. So first branch is the right conus artery. In case of right coronary artery, the branches, how it is divided? It is divided into atrial rami and ventricular rami. Okay. Now in ventricular rami, first we are getting the right conus artery. Okay. So this right conus artery will be supplying the infundibulum of the right ventricle. Now sometimes this right conus artery, it directly arises from the anterior aortic sinus. In some cases, not always. So if this right conus artery is arising from the right anterior aortic sinus, in that case it is called as third coronary artery. Okay, in the beginning I have mentioned, if I ask you which one is the third coronary artery, okay, so this is the third coronary artery, the right conus. Now this right conus artery, okay, will anastomose with the left conus artery. Okay. Now when they are anastomosing, they will form a necklace, okay, in front of the or around the infundibulum of the right ventricle, and that anastomotic necklace which is formed, that is called as annulus of Vuesens. Okay. So see, each and every stage, as we are going for further, I am mentioning that the anastomosis is being taking place. So in this case also you have seen the anastomosis is taking place. Okay. Next is the right anterior ventricular rami. Okay. So the ventricular rami and the atrial rami, what the division, you can see it is divided into anterior as well as posterior, because it has to supply the anterior aspect, and there are some branches which appearing on the posterior aspect. So they will supply the posterior aspect of the atria and the ventricles. Now this right anterior ventricular rami, 3 to 4 in numbers. Okay, so they arise at right angles from the trunk of the coronary artery, and then what it will do, though they are arising from the anterior aspect, very simple, it will supply the sternocostal surface of the right ventricle. Okay, so they will supply the sternocostal surface of the right ventricle. Now among them, one artery is there which is significant, that is the right marginal artery, which is the longest ventricular rami. Now this longest ventricular ramus, that is the right marginal artery, it follows the inferior border of the heart towards the apex and supplies the adjacent area. So this is about the ventricular rami. Next is the atrial rami. Now atrial rami, they are arranged, how they are arranged? In the form of anterior group, lateral group and posterior group. Okay. Now they will supply the myocardium of the right atrium. Okay, though it is atrial rami. Now from atrial rami we are getting the SA nodal artery. Okay. Now this SA nodal artery, in case of 65% population, it is derived from right coronary artery, and in 35% of cases it is derived from left coronary artery. Okay. Next is the right posterior ventricular rami. Okay, that is on the posterior aspect of the heart. So this posterior ventricular rami, it gives branches of the right coronary artery, okay, which is the part of atrioventricular group and supply the diaphragmatic surface of the right ventricle. So the right posterior ventricular rami, if it is on the posterior aspect, then it will supply which part? It is supplying the diaphragmatic surface of the right ventricle. Okay. So like this, the branches, though there are so many branches, but the division is done in such a way that if you understand the branching pattern, easily you can write that this particular branch is supplying which area of the heart. Next, the posterior interventricular branch. This is the most important branch. Why it is important branch? Based on the occurring of this branch, or you can say based on the origin of this particular branch, the codominance is dependent. Whether it is right dominance or left dominance, it is dependent only basis of the origin of this posterior interventricular branch. Okay. Now in 70% of the subjects, the posterior interventricular branch arises from right coronary artery. Okay. And about 10 to 15% it is arising from the left coronary artery. So if this particular branch is arising from the right coronary artery, then it is called right dominance. If it is arising from left coronary artery, then it is called left dominance of the heart. Okay. Now this particular interventricular branch, okay, it arises from the right coronary artery as a single branch in 70% of the subject. means majority of the interventricular branch, posterior interventricular branch arising from the right coronary artery. Now, if you see the posterior interventricular branch, it will pass through posterior interventricular groove, okay, close to the apex, and then it will anastomose with the anterior interventricular branch. And this anterior interventricular branch, okay, is nothing but the continuation of the left coronary artery. Now, in 10% of the individual, the posterior interventricular branch is derived from the continuation of the left coronary artery. Okay. Now, on the basis of the continuation of the interventricular artery, whether it is right coronary dominance or left coronary dominance, it is determined. Okay. Now, this posterior interventricular branch will provide few branches to the diaphragmatic surface of both right as well as left ventricle. Now, from this posterior interventricular branch, we are getting a septal rami, okay, which will supply the posterior inferior 1/3 of the septum, that is the interventricular septum. Okay. Next, AV nodal artery is there. 80 to 90% of the AV nodal artery is derived from right coronary artery, and 10 to 20% in case of left coronary artery. Okay. So these are some statistics where it was found that the AV nodal artery is mainly derived from the right coronary artery. Okay. And lastly, we are getting the right posterior atrial rami. So this posterior atrial rami, if you see, it is supplying the majority of the posterior surface of both right and left atria. Okay. Now here is the diagram. Now this diagram I have selected for you guys so that you can draw this diagram. Just see the diagram is very easy diagram. Okay, drawable diagram. Now in this particular diagram you can see the right coronary artery. See, this is the right coronary artery. So you can see the origin of the right coronary artery. After that you can see the course of the right coronary artery, and this is the termination of the right coronary artery. Along with that, all the branches whatever I have mentioned just now, okay, the ventricular rami and the atrial rami, those can also be seen over here. So see, these are the ventricular rami, these are the atrial rami. Okay. Next you can see the SA nodal branch, you can see the AV nodal branch, okay, and then you can see this is the posterior interventricular, this one, this is the posterior interventricular branch. Okay. After that you can see the recurrent branch also. Okay. Next you can see the septal rami. So this is one septal rami, this is another septal rami. So this particular septal rami will supply the interventricular septum. Okay. So I hope you have seen this diagram. Now this is the easiest diagram, and one particular diagram will help you to understand the course, origin, course, termination branches of the both the arteries. Now please note that in case of writing about the coronary arteries, you have to draw two such diagrams. First diagram showing the anterior aspect, second diagram showing the posterior aspect. Okay. So here you can see this is the diagram showing the branches of coronary artery anterior view. Now another diagram is there. This is the branches of coronary artery showing the posterior view. Okay. Now here also you can see this is the right side, this is the left side. You see, this is the right coronary artery, the posterior segment. Okay. As you can see, the anastomosis which is taking place, that also on the left side of the crux of the heart. Next you can see this is the posterior interventricular branch. Okay. Based on that only the codominance or predominance is determined. Next here you can see anterior interventricular where the anastomosis is taking place, and then you can see the other branches over the posterior aspect of the heart. Okay. So these two diagrams are very important. These two diagrams will help you to understand the branches specially of anterior and the posterior aspect of the heart. Okay. So I will request everyone to practice these two diagrams so that in the exam if the question comes you can draw the diagram, and this is a very easy diagram. Next, in case of right coronary artery, what is the area of distribution? So we have seen right coronary artery, everything about the right coronary artery. Next, what is the area of distribution? In which particular part of the right coronary artery is supplying the heart? जो right coronary artery है, along with the branches, it is supplying which particular part of the heart? So first of all, entire right atrium is supplied, then ventricles. Now here you have to see all the ventricles are not supplied by the right coronary artery. Okay. Now the greater part of the right ventricle, except the area adjoining the anterior interventricular groove, okay, is supplied by right coronary artery. Next, a small part of the left ventricle adjoining the posterior interventricular groove is also supplied by the right coronary artery. Okay, so these are the areas of the ventricles. Next, posterior part of the interventricular septum is supplied by right coronary artery. Whole of the conducting system of the heart except the left branch of the AV bundle. Okay, so these are some areas of the heart which are supplied by the right coronary artery. Okay. Now next is the left coronary artery. The way I have explained the right coronary artery, similarly we have to discuss about the left coronary artery also. Okay. Now if you see the left coronary artery, it is having larger caliber. That means the diameter of the left coronary artery is more as compared to the right coronary artery. Left coronary artery is supplying more blood, okay, to the heart as compared to the right coronary artery, because left coronary artery has to supply the left ventricle, and you have seen the thickness of the left ventricle. What is the ratio between the thickness of right and left ventricle? Anyone? Yes, it is 1:3. If you see the thickness of right ventricle, if you see the thickness of left ventricle, what is the ratio? 1:3. It means the left ventricle is 3 times thicker as compared to the right one. It means it needs more blood, and that is supplied by the left coronary artery. So left coronary artery is supplying more blood as compared to the right coronary artery. Though the branches are less, but blood supplied are more by the left coronary artery. Okay. Next, similarly, where what will be the origin? Now it arises from the left aortic sinus of the ascending aorta. Okay. Mainly between the pulmonary trunk and the left auricle of the left atrium. Now once it appears, okay, it will go towards the left side, okay, between the pulmonary trunk and the left auricle, and immediately it will divide into two terminal branches, that is the anterior interventricular branch and circumflex branch. Now here there are some important points which you have to know. This anterior interventricular artery is also called as LAD, left anterior descending. Okay, if you have seen any CT coronary angiography report, okay, I don't know whether you have seen or not, or any coronary angiography report, at that time it is mentioned as LAD. They used to use this short form. So LAD का मतलब क्या है? Left anterior descending, which is nothing but the anterior interventricular branch. ठीक है. Next, the circumflex artery. In books I have seen it is written as circumflex artery, but clinically they used to write as LCX, the short form. LCX इसका मतलब क्या है? Left circumflex artery. Okay. So as you will go to the next semester, if you go for posting at that time, you can see those cases. So that time it will be mentioned as LCX, left circumflex artery. Okay, so from there you have to understand. Now here you can see the left coronary artery. Okay, so here also the origin which is taking place. After that you can see it is going towards the left side, and then immediately after a small course in between the pulmonary trunk and the left auricle, you can see it is dividing into two terminal branch. Okay, so one is the circumflex artery, circumflex branch, and this one is the LAD, left anterior descending, or also called as anterior interventricular branch. Okay, so in case of left coronary artery, though the main trunk is very small, when it is dividing into two terminal branches, okay, so those terminal branches, they will give rise to the various branches. Okay, same like the right coronary artery only. So here you can see the ventricular rami. Okay, here you can see the ventricular rami. Here you can see the diagonal branch, the branches which are coming out from the LAD, left anterior descending. After that you can see the LCX, the circumflex branch, and from the circumflex branch also you can see the various branches which are coming out. Now anterior interventricular artery is the continuation of the left coronary artery. Okay. Now when it is descending, it will descend in its corresponding groove, that is the anterior interventricular groove. Okay. Now once it is descending in the anterior interventricular groove, it is towards the apex of the heart. Okay. Once it reaches towards the apex of the heart, it will wind around the apex of the heart, okay, on the inferior surface. Once it is going to the inferior surface, okay, what it will do, it will anastomose with the posterior interventricular branch of the right coronary artery, and the anastomosis is taking place at the junction of anterior 1/3 and posterior 2/3 of the posterior interventricular groove, where it will terminate. Okay, that is the course and termination of the anterior interventricular branch. Now this anterior interventricular artery, it also giving various branches. Okay, if you see the branches, first of all, ventricular rami are there, anterior ventricular rami, okay, for both right and left ventricles. Okay, ventricular rami for both right and left ventricles. Next, the left anterior ventricular rami are prominent. Left anterior ventricular rami are prominent because they have to supply the left ventricle. Okay. Now among them, one particular ventricular rami is large, and that is called as diagonal artery. Okay. Next, from the right side of the ventricular rami, okay, we are getting the left conus artery. So that left conus artery will anastomose with the right conus artery, which I have shown you earlier. Then we are getting the septal branch. Okay. Now this septal branch from the ventricular rami will anastomose with the septal branch of the right coronary artery. Okay. Next, in case of circumflex artery, also various branches are coming out from the circumflex artery. So here also we are getting the atrial and ventricular rami, which will supply the adjoining part of the left and right ventricle. Then nodal artery, that also only in 35% of the case it is coming out from the left coronary artery. Next, left marginal artery, okay, which is prominent branch, okay, along the left border. Next, posterior interventricular artery, only in case of 10 to 20% of the individual, posterior interventricular artery is arising from the left coronary artery. And then the atrial branch, okay, of the circumflex artery, which communicates with the seminal branch of the right coronary artery, and this arterial anastomotic channel is called as Kugel's artery. Okay, so now I will show you some important anastomotic channels which are taking place in between the right and left coronary artery. Now this is the diagram. This is a 3D diagram where you can see different anastomotic channels are formed. Okay, and those anastomotic channels are formed which are related to the infundibulum of the right ventricle. Okay, so here you can see this view is superior view of the heart which is taken. Okay, now from that particular superior view you can see the anastomotic channels which are mainly related to the conus, or also you can say the infundibulum of the right ventricle. Okay. So here you can see this is the infundibulum of the right ventricle, also called as conus. So see, these are the anastomotic channels. Okay. Now first, preconal ring or see, this is the preconal ring, or also called as Busen's arterial ring. Then this is retroconal ring, and here you can see the retroaortic ring, or also called as Kugel's interarterial ring. Okay, so here you can see the anastomosis is taking place in between the branches of the left coronary artery and branches of the right coronary artery. Okay, and this is the cut section of the ascending aorta, where you can see the aortic sinuses from which the right and left coronary artery is taking place. Okay, so these are some important anastomotic channels which are formed, okay, at the various part, especially they are related to the infundibulum of the right ventricle, in front, behind the infundibulum of the right ventricle, and behind the ascending aorta. Next, the area of supply in case of left coronary artery. Okay, so area supplied by the left coronary artery, left atrium, okay, then left ventricle, except the area adjoining the posterior interventricular groove, which is not supplied. Next, right ventricle adjacent to the anterior interventricular sulcus. Only this part is supplied by the left coronary artery. Next, SA node in 35% of the cases and part of the left branch of the bundle of His. So these are the areas which are supplied by left coronary artery. Okay, next is the cardiac dominance. Already I have mentioned what is this cardiac dominance based on the posterior interventricular branch, whether it is coming from right or left coronary artery. Now there are some cases less than 10%, okay, where the posterior interventricular branch arises from both right and left coronary artery. In that case, it is called as codominant. Now here you can see I have used some short form, for example RCA, okay, that is the right coronary artery, okay, then PDA, posterior descending artery, LAD, left anterior descending. Okay, why I have used? Because these are the terminologies, clinically these terminologies are being used. Okay, next, in the applied importance, it is very interesting. I hope you have heard about CAD or coronary artery disease. इसमें क्या होता है? What happens in case of coronary artery disease? It is caused by inadequate blood supply to the cardiac muscle due to the occlusion of the coronary artery. Okay, so through coronary arteries, blood is flowing. If there is any occlusion of the coronary artery, then what will happen? There will be inadequate blood supply to the muscles of the heart, and in that case, it is called as coronary heart disease. Now, this occlusion which is taking place, either it may be partial obstruction or there may be complete obstruction of the coronary artery. Now, when the occlusion is taking place, it is mainly due to the atherosclerosis. Okay. Now, atherosclerosis is mainly formed due to the deposition of the cholesterol along with that calcium or other substance which are passing through the blood. Now, when the fibrosis is taking place, then it is called as atherosclerotic plaque. Now, in this case, what will happen? The lumen of the coronary artery will become narrow, and that will hamper the blood flow through the coronary artery. Now, there is a diagram. In this diagram, you can see the healthy artery. Okay, you can see the fatty streak which is being deposited in the lumen of the blood vessel. After that, you can see accumulation of the smooth muscle cell, then foam cells. All those things are developed. Okay, foam cells, these are the special type of immune cell. When fatty streak is deposited in the blood vessel, wall of the blood vessel, those foam cell used to go and dissolve those fatty streak. In that case, foam like appearance are taking place under microscope when the slide is prepared. That's why these are called as foam cells. Okay. Next, you can see the ruptured plaque with thrombus formation is taking place. As a result, what will happen? You can see the diameter of the blood vessel is reduced. That means the lumen will become narrow. If the lumen becomes narrow, then the blood flow E will be reduced. Okay. Now there are some important terminologies. So development of the atherosclerotic plaque is common in the coronary artery near the origin of the aorta. Okay. Next, what will happen? This plaque will activate the platelets, resulting in thrombosis, and a blood clot is called as thrombus. So when the platelet will get activated in that particular area, at that time what will happen? Thrombosis will take place and the clot will form, and that is called as thrombus. Okay. Now when 3/4 of the lumen is obstructed either by the plaque or by the thrombus, okay, so two things are different. Thrombus is different, plaque is different. Just now I have shown you how the plaque is formed. Okay, thrombus means when the platelet used to get activated in this particular area, a clot formation will take place. So that formation of the clot is called as thrombosis, and the clot which is formed, that is called as thrombus. Doesn't matter whatever is forming, it will hamper the blood flow. That means the blood flow will get reduced to the myocardium. once the blood flow is reduced to the myocardium, that particular case is called as ischemia. Okay. Along with that, when the thrombosis is taking place, the spasm of the blood vessel is also present. Now, the smaller blood vessels are occluded by the thrombus or part of plaque detached from the coronary artery. Okay, suppose a clot is formed, okay, and from that particular clot a small portion is detached, and then it start flowing in a particular blood vessel in the smaller branches. So that will go and block the smaller blood vessel. Okay. Now that dislodged part is called as embolus. Now here you can see the diagram. It's a beautiful diagram where you can see the thrombosis, where the clot formation is taking place. Okay. So once the thrombus is formed, as you can see, the blood vessel, diameter of the blood vessel is reduced. Next, what will happen, from this particular thrombus, a small portion is detached, and you can see it is flowing through the blood vessel. Once it will reach the smaller blood vessel, at that time what it will do, this embolus will block the smaller blood vessel. Okay. So like this the blockage is taking place. So like this you can see the artery is completely blocked. Okay. So this particular formation is called as thrombosis. Okay. The clot which is formed, that is called as thrombus. From the thrombus, okay, if the particular part is dislodged and it is traveling in a blood vessel, then it is called as embolus. Okay, and that embolus or emboli can go and block a smaller blood vessel. Okay. So what is thrombus? It is a blood clot that forms in a blood vessel and remain over there. That is the thrombus. And the process of formation of the thrombus, that is called as thrombosis. Okay. And what is embolism? That is a clot that travels from one side to another location of the body, that is the embolism. Okay. Next, in case of myocardial ischemia, it is a reaction of the part of myocardium due to the response of hypoxia. So if there is inadequate blood supply, then what will happen? There will be hypoxia. Okay. So this hypoxia develops when the blood flow of the myocardium decreases. Especially it is due to the occlusion of the coronary artery. Now blood flow is usually restored if a small part of myocardium is affected, okay, because of the collateral circulation. Now another important terminology is there, that is the infraction. Now what is that infraction? In infraction, complete obstruction of the blood flow is taking place. As a result, what will happen? There will be ischemia. After that, there will be necrosis, okay, of the tissue. So in case of infraction, the necrosis of the myocardium caused by insufficient blood flow due to the embolus, thrombus or vasospasm, different reasons are there, and it is also called as heart attack. In myocardial infarction, death occurs mainly due to the ventricular fibrillation. Now clinically, myocardial infarction is also referred as MI. Okay, so if it comes as what is MI, don't get confused. MI ka matlab is myocardial infarction. Okay, so there are various symptoms of it. For example, nausea, vomiting, sweating, shortness of breath, tachycardia, pain beneath the sternum radiates to the surface of the left arm, left shoulder. Okay, sometimes it is referred to as to the jaw and neck, and that condition is called as angina pectoris. Now what are the common sites for this obstruction? Okay, so anterior ventricular artery or left anterior descending artery are also called as LAD, 40 to 50% of the cases. That means when the MI, myocardial infarction, is taking place, at that time which arteries are most commonly blocked? Okay, among them the most commonly blocked are the LAD, left anterior descending, okay, in 40 to 50% of the cases. Then right coronary artery, 30 to 40% of the cases. Then circumflex branch, okay, LCX, 15 to 20% of the cases. Okay, so mostly anterior interventricular branch or LAD is to get blocked in myocardial infarction. Okay. Next, there are some other important terminologies. For example, coronary angiography. So it is a radiological procedure which is used to visualize the patency of the coronary arteries. Okay. Now, exactly where the block is taken place, we don't know. For that, coronary angiography is done, where contrast media is injected into the coronary arteries, and after that, scan is done, so that if there is any blockage inside the blood vessel, that can be diagnosed easily. Then bypass surgery is also done, where a artery is attached to the part where the block has been taken place and distal to the blockage, so that the blood can flow through the alternate way. Now this is a diagram of CT coronary angiography, okay, where you can see the blockage has been taken place. Now, as I said, blockage may be complete or it may be partial. So here you can see the blockage 10%, here 10 to 50%, 50 to 70%, and this more than 70%. So this is the blood vessel through which the contrast media is flowing. Here also blockage is there. Now, after giving the contrast media, when the scan is done, at that time, how to detect? Whenever the contrast media is flowing through any of the structure, that particular structure will become highlighted. That means it will become more brighter as compared to the surrounding areas or surrounding tissue, which you can see in this particular diagram, in this particular image. So this particular part, contrast media is present, that's why it is more highlighted. Okay. Now here blockage is there, that's why the contrast media is unable to flow properly. But still some amount is flown, that's why some enhancement is shown. Now here you can see it is very less, and in this case also you can see it is very less. So like this, based on the flow of the contrast media through that particular blood vessel, the diagnosis can be done. Okay. Next, another image is there. This is also a very beautiful image of CT coronary angiography, where you can see plaque causing the severe blockage of this particular area. Okay, so where the blockage has been taken place, this area is not highlighted, this area is not enhanced. Okay, because of the blockage, the contrast media is unable to flow along with the blood. Okay. Okay, so these are some important and interesting points which I have discussed. Along with that, another important point is there, that is the angioplasty. Okay, in angioplasty, if the blockage is there, a balloon catheter is inserted, balloon catheter is inflated, so that the blockage part will get enlarged, and then if required, stent is placed in that particular area. Okay, that is called as stenting. So these are some important applied aspects of the coronary arteries. Okay. So if this particular part comes during the time of exam, you have to mention some of the applied importance also. Okay. So I hope we have discussed so many things in coronary artery today, and hope it will be helpful for you. Okay. Thank you, and all the best for today's exam.